So my area of expertise is adult congenital heart disease, so folks who were born with heart defects as kids and then have grown up to need adult cardiology care. The transition from pediatric cardiology to adult cardiology can really be, I think, jarring to a lot of folks who are used to, one pediatric cardiologist often that they followed with their whole life. I try to sort of bridge that gap. That's a really important time for a patient with congenital heart disease to not fall through the cracks, and oftentimes that does unfortunately happen due to changes in care. And so that's a great time to sort of recheck in, especially when someone's a young adult and they're now maybe attending appointments without their parents. Do you understand your congenital heart disease? Do you understand, the history that your parents have typically supplied? And how can we sort of launch you into adulthood and give you your own empowerment to take care of your own care going forward? I do a lot of drawing because, again, a lot of folks, especially if they're transitioning from pediatric to adult care, but even if they're just sort of reestablishing and they haven't been seen in a while, it's complicated, and I think it empowers the patient to understand literally how is their heart hooked up, where does the plumbing go, where are the holes, where are the problems, what are the things that are working well. So I do a lot of drawing with the heart model because I'm not much of an artist myself, but this is the issue, these are the things that have been fixed, and I think that really helps the patient conceptualize what are we talking about, what are the issues going forward, and they take that with them and can reference that when they're needing a reminder at home. My main focus outside of work at this stage of my life is my son. I have a little 1-year-old who runs around, and we chase after him and have a good time, spending a lot of time outside.